what is the equivalent to the PRP or the P shot for women?
Well, women get one step further than what men get. They get a combination of procedures that work tremendously well. So we do a lot of ThermiVa. We typically do the ThermiVa procedure 3 times. So that's vaginal rejuvenation, because the RFA technology, radiofrequency ablation, it sort of stimulates the crypts inside of the vagina. A lot of times when we do bioidentical hormones, a lot of times the dryness and the atrophy get better, but underperformance sometimes still not where most women want to be. So by using the radiofrequency ablation, what it does is it warms those tissues up, it stimulates the crypts, which are what create the moisture. It also, again, causes neurovascular regeneration, so you get some tightening of the collagen and the elastin, so it tightens the vaginal vault. It actually shrinks the external tissues, and what we also learned that if we use that over the clitoris and the clitoral hood, then that neurovascular stimulation really gave them, tremendous results from that. So typically what we do is we package these all together, and we'll do 3 different ThermiVa procedures spaced out by about 30 days. And then at the very end of that, we do 1 or 2 different things. Again, it depends on what your budget, what your price point is. Are we going to use PRP alone? Or are we going to use PRP with the stem cells, which is definitely the best way to go. We call the PRP with the stem cells, that's called the V shot. So what we do is we do a few little injections in the clitoral hood and then into the clitoris itself. But then we also inject it into the superior vault of the vaginal wall. So just like the ThermiVa is sort of helping with stress incontinence by tightening those external sphincter muscles right there, that's what adding that injection does for women as well. And it also is an injection into the mythical G-spot, but the women all have, tremendous results from that. Now, if they can only afford the PRP injection, we call that the O shot, the orgasm shot. We do everything the same way. It's just without the addition of the stem cells.
Now, does this hurt?
Women are a lot tougher than men. And I can tell you, over 75% choose not to have conscious sedation. We have this thing called, it's nitrous oxide mixed with oxygen. It's called Pronox. So at the very, very low dose where we mix it up, it's not like the laughing gas where you get like that, but it's an analgesic. So it comes out sort of in a water vapor sort of form. So they'll take a few puffs off of the Pronox, and we can sort of tell when they get this silly little grin on their face that now's the split second that we have to do anything that might hurt. And they remember it, but they say, I just didn't really care. I could tell that it did sting like a bee, just like what you told me it was going to, but I didn't care. So you sort of disassociate from what is going on. But, women are tougher than men. More of them stay away, but there are some that say, I don't want to feel anything. And again, it's a 5 to 10 minute trip to La La Land, and, having the board certified anesthesiologist here to do it just, makes it that much safer and easier.